So, obviously, professional dental cleaning is huge. Dental x-rays should always be included as part of the process of your dental cleaning, your pet's dental cleaning, so that we can see what kind of disease is going on underneath. If a pet needs extractions, not that big a deal. With your permission, we can go ahead and do a little Novocaine type anesthetic locally so that it's not painful to take the tooth out, suture that back together, and they will be far less painful afterwards. Home care after a cleaning. It's the perfect time to do it. Those teeth are absolutely clean and immaculate. That's the time to get in and clean. That and on your youngsters, okay? You're starting with perfectly clean teeth. But don't be discouraged. What if your dog has a little bit of tartar, a little bit of plaque, and this just isn't a good time to get a dental cleaning? Maybe financially it's just not great right this second and you want to wait a little bit. Not a problem. There are still plenty of things you can do with home care products to try and kind of keep things under control, reduce the accumulation of new plaque and new tartar, okay, until you're in a situation where you can indeed go ahead and proceed with a professional cleaning. Worried about anesthesia? You really don't have to. Okay, it's a really light plain anesthesia, okay, far less than is used for a spay or a neuter. Okay, it's super, super light. It's just a hair past twilight. Okay, again, we use things like Novocaine so they don't feel us, so that we do not have to crank up that anesthesia to keep them comfortable while we're cleaning their teeth. They go home the same day. Typically, they go home, they're really excited, they run around, they're glad to be home, they're glad to see you, and then they go take a really good long nap. Okay, not a whole lot different from when I've had anesthesia, truthfully. Okay, so it's really not a lot different, and it's super, super safe. Pre-anesthetic lab work to make sure their liver and their kidneys and all that is great. Absolutely essential. IV fluids during the procedure to maintain blood pressure and have access if there are any problems. There are lots of things that we do to make sure that they stay safe under anesthesia. We're monitoring that heart rate. We're looking at mucous membrane color to make sure that they're fully perfused. We're watching their blood pressure. We're watching their EKG, their body temperature, their oxygenation in their blood, okay? This is a high-tech world we live in now. Okay, not perfect, but pretty darn close. We can watch these kids super, super, super carefully while they're under their anesthetic procedure, which is, by the way, not terribly long. Okay, as long as they don't have extractions, it's not. If they have extractions, it takes a little bit longer. But obviously, it's always done with the same kind of care to make sure that they are safe, because that is more important than anything else. Okay, dental cleaning is nothing to be afraid of.